Coming up, it is a disturbing trend despite more education out there. The number of people getting sexually transmitted diseases is on the rise. We are talking with Dr. Sharon Thompson next about who is most at risk and why she thinks more people are getting STDs. Welcome back to Good Morning Arizona. It is time for your Health Watch this Monday. We're talking about the spread of sexually transmitted disease. It's on the rise for the first time in a decade. It is shocking. Dr. Sharon Thompson of Central Phoenix Obstetrics and Gynecology is joining us this morning to talk about the disturbing trend, and it is impacting young people at the highest rates.
Absolutely. So the CDC, which is a government agency that does great work, publishes data on many health indicators, but STDs is one. And in the latest publication, we noticed that STDs have risen, which has been against the trend since 2006.
So what can we attribute this to?
You know what? There are probably multiple factors, but I think one of them is the success of treatment of HIV. So for the older generation, Generation Y, I think that would be, we grew up with HIV. We came of age sexually in this era of a deadly infection.
Being terrified of contracting something sexually.
So we were more diligent about condom use, and now that terror is gone because HIV treatment has been so successful that HIV is now a chronic disease. If you take medications, you can stay healthy, and that fear that was so present in our generation is not there. The need is still the same, though. You still have to make smart decisions about sexual activity, and still condom use is essential for helping to prevent spread of STDs.
Well, and I think that's a real failure on the part of the system as a whole, because even though we know people are living with HIV, they're living in a lot of discomfort, a lot of pain. Those medications often give very tremendous side effects. Their quality of life is not what it once was.
Absolutely. Having any chronic disease requires that, you change your lifestyle, you make different decisions, and it's expensive.
Yes.
So the cost of STD treatment is in the $15 to $16 billion range annually. So it is significant. And for the individual, medications are costly. They're life-saving, but costly.
Pull up some of the statistics that you shared with us here on your screen so that this can kind of drive home some of the points of some of the illnesses that we're seeing, too. 1.4 million cases of chlamydia, syphilis up by 15%. I mean, these are almost, syphilis was a disease that we thought had gotten rid of entirely.
Absolutely. So syphilis is a disease that's scary because it can be deadly. It requires it has different stages, and you can miss it in the early stages and then require extensive treatment or have side effects that don't go away even with treatment. So it's a disease to be feared, and it's very concerning that it's increasing.
What are the long-term implications of some of these STDs?
I'm glad you asked that question, and especially in the populations where we see it in young people, STDs can often be asymptomatic, or you can miss the symptoms and wind up with consequences like infertility, increased risk of ectopic pregnancy, and babies can acquire some STDs and wind up with significant problems. If you've ever wondered why babies get ointment in their eyes at birth, it's to help prevent the consequences of chlamydia, which can lead to blindness. So the consequences of STDs can be quite severe, so it's so important to make good decisions and to use condoms with new partners. Also, getting tested and treated. Don't be in denial about your activity.
Get tested.
Be open and upfront with your provider, get tested, get the necessary treatment.
Dr. Thompson, thank you so much.
You're welcome.
Have Dr. Thompson's information on AZ Family, Central Phoenix Obstetrics and Gynecology. Always great to see you.
Thank you for dealing with this very important topic.